Hi friends, welcome to classes by Lab Doctor. I'm Dr. Divya and in today's class let us discuss about serum potassium. ये जो सीरम पोटेशियम ब्लड टेस्ट है ये आपके ब्लड में पोटेशियम इलेक्ट्रोलाइट को मेजर करता है. So potassium like chloride, sodium, magnesium, calcium, this is also a important electrolyte. Electrolyte is nothing but an electrically charged element, and this is important because it helps in maintaining the acid base balance, the pH of our blood, to maintain the muscle conductivity, nerve conductivity. For all these important functions we need these electrolytes, and potassium भी ऐसा ही एक electrolyte है. So ये जो potassium है, it is mainly concentrated inside the cell. The potassium levels are more inside the cell compared to outside. Outside the level of potassium is very low. In serum, the normal range of potassium is up from 3 to 5 milli equivalents per liter. इतना ही कम है. Whereas inside the cell it is 150 milli equivalents per liter. And this potassium, it will help your heart muscles, your nerves, your skeletal muscles to work properly. Most of the potassium what we get is from the food what we eat, and almost all of the potassium in your body is inside the cell, what I have told you, around 150 milli equivalent per liter, and very small, around 4 to 5 milli equivalents per liter is seen in your blood. And kidney is one of the important source which helps us to remove the excess potassium and to maintain the potassium balance. Too much of potassium and too less of potassium can be dangerous. Sodium potassium ATPase, ये जो pump है, this is very important in maintaining the potassium levels, and this is the one which maintains your resting membrane potential. आपके nerve conductivity के लिए, heart के impulses के लिए ये important है. So this sodium potassium pump will remove 3 sodiums and it will push to a potassium inside. So that is why the potassium level is more inside compared to outside, and sodium level is more outside the cell compared to inside, because of this sodium potassium pump. So I have told you the most of the potassium comes from our diet, like banana, your avocado, all these are rich in potassium. So that is rapidly absorbed in the intestine, and once the body takes enough of potassium, the rest is excreted through the kidneys. So there will be glomerular filtration, it goes to the proximal tubule, wherein the absorption and excretion takes place. There is ion exchange for sodium, and the excess potassium is excreted in the urine. So this is how the potassium is handled by the kidney. Potassium and sodium pump is very important in maintaining the homeostasis of potassium in the blood. So this potassium does some important function, like it maintains the intracellular osmolality, it maintains the intracellular neutrality in response to sodium and H plus ions. It is required for the glycogen deposits in the liver and skeletal muscles. It maintains the cardiac rhythm. See, potassium deficiencies or increase mainly causes changes in the heart, whereas sodium deficiency or increase, it affects the central nervous system. The potassium also maintains the smooth muscle and skeletal muscle contraction. This slide becomes very important because when we study about hypokalemia or hyperkalemia, there are few factors which you should know which will increase the shift of potassium inside the cell, and there are few factors which will bring out the potassium from the cells. So if we understand this slide, we will be able to jot down the causes of hypokalemia as well as hyperkalemia. So there are few factors which will shift the potassium inside the cell. One is insulin. So insulin is an important hormone which will push the potassium into the cell. Insulin also pushes the glucose inside the cell. Insulin also pushes the phosphate inside the cell. Insulin also pushes the proteins, amino acids inside the cells. So suppose if there is an insulin excess like insulinoma, more of the potassium will go inside the cell and less will be there in the serum. Therefore, there will be hypokalemia. So all these factors like this insulin, aldosterone, etc., they are going to cause hypokalemia. Less potassium in the serum and more of potassium inside the cell. So when there is more potassium inside the cell and less potassium in the blood, we called it as hypokalemia. Similarly, aldosterone. And this aldosterone, what it will do? It will increase the reabsorption of sodium and increase the excretion of potassium and H plus ion. So that also causes hypokalemia. This epinephrine, that is the beta adrenergic stimulation. Whenever there is beta adrenergic stimulation, that will stimulate the sodium potassium pump. So it will cause more of potassium inside the cell. It will absorb more of potassium inside the cell. So there will be hypokalemia and alkalosis. Whereas there are certain factors that will shift the potassium outside the cell. That means it will cause increased potassium in the blood. Like you have insulin deficiency, type 1 diabetes. Diabetes mellitus is going to cause increased potassium in the blood. Aldosterone deficiency like Addison's disease, that will cause increased potassium inside the blood. Beta adrenergic blockers, they are going to cause increased potassium. Acidosis, and when the cell is lysed, when the muscles are lysed like rhabdomyolysis, hemolysis, the potassium inside the cell is going to come into the bloodstream and cause hyperkalemia. Whenever factors like insulin, alkalosis, etc. help the potassium to enter the cell, the level of potassium in the blood is going to decrease. That is hypokalemia. And whenever there are factors like acidosis, hyperglycemia, increased osmolality, etc., or cell breakdown, etc., which will cause more of potassium to be outside the cell, then the level of potassium in the blood will increase. That is hyperkalemia. So in acidosis, I have told you what happens in acidosis. There is increased H plus ion. So this increased H plus ion, when the concentration is more, it goes inside the cell. So when it goes inside the cell, a positive charged ion has to come out to balance. So the potassium comes out of the cell. So in acidosis, you will see that the level of potassium will be more outside the cell. So there is hyperkalemia. Beta 2 agonist drug. Beta 2 agonists are the drug which we use in the treatment of COPD, chronic obstructive pulmonary diseases, asthma, emphysema, etc. So they are like albuterol, or it could be levobuterol, terbutaline, etc. So what these drugs will do, beta agonist drug, they will activate this sodium potassium pump. So for this, when the sodium potassium pump is activated, there is increased potassium which goes inside the cell. So the level of potassium outside, that is in the blood, will go down. So that will cause hypokalemia. That is why whenever there is hyperkalemia, we can use this kind of drugs to treat the hyperkalemia. Now the opposite happens with beta blockers. Now beta blockers like atenolol, bisoprolol, labetalol, all this, what they will do, they will block this sodium potassium pump. And when you block the sodium potassium pump, there will be more potassium outside than inside. So that will cause hyperkalemia. Thyrotoxicosis. This thyroid hormone also will stimulate the sodium potassium pump. So it will also cause more of potassium to go inside than to come outside. So in case of thyrotoxicosis, what happens? The increased level of potassium is there inside the cell compared to outside. That is why there is hypokalemia. So sometimes patients with this thyrotoxicosis, hyperthyroidism, go in for a flaccid paralysis, etc. Similarly, in Conn's syndrome. So what is Conn's syndrome? Conn's syndrome is nothing but hyperaldosteronism. So what does this increased aldosterone do? It will increase the absorption of sodium and increase the excretion of potassium. That is why the kidneys will excrete more of a potassium, and that causes low potassium levels and hypokalemia. So whenever there is low aldosterone, so when there is hypoaldosteronism, what happens? The adrenal glands do not produce enough of aldosterone. So this will lead to high potassium in the blood because there is less of potassium excretion. So that is why there will be hyperkalemia. So the other symptoms which are associated with hypoaldosterone is low sodium, metabolic acidosis, and hyperkalemia. So these are the normal ranges of potassium. Remember, the ranges vary in adults, in infants, in newborns, in urine, and in CSF. The normal range in an adult would be around 3.2 or 3.5 to 5 milliequivalents per liter. In newborn, it would be slightly high. It can be up to 5.9 milliequivalents per liter. In the next classes, we will see what are the causes for low potassium and high potassium, what are the symptoms of hypo as well as hyperkalemia, and how do we treat the hypo as well as hyperkalemia. So that is all about serum potassium levels. Thank you so much for watching the video. Please like, share and subscribe the channel. Thank you.